One of the biggest questions families ask me is, will Medicare pay for this? Yes, it will, specifically when it comes to home health and hospice. In this video, we're going to break down how Medicare pays for home health and hospice, and how is it going to help you or your loved one be safe at home. Let's go. So let's talk about how Medicare covers home health. Medicare covers home health under Part A and B. There's three things that's needed when it comes to home health and Medicare in order to receive those services. You must be homebound, you must be under a care of a doctor, and there must be skilled services that's needed, like nursing, therapy, PT, OT, those services that cannot be performed by a layperson, someone who has a license under that state and can perform those services for your loved one. So now what's not covered under home health for Medicare is the 24-hour care services like ADLs, bedside care, cleaning, the house needs for your loved one or for yourself. Those things aren't covered by Medicare. Those are usually paid out of pocket or through long-term care insurance. But Medicare does not cover those things for home health. Let's talk about Medicare and then hospice services. So hospice is covered by Medicare under Part A. So if you don't have Part A under Medicare, there's A and B, then you cannot receive hospice services unless you have another either insurance or contract that you have with Blue Cross Blue Shield, United Healthcare, and they have in-network benefit for hospice services. But if you do have Part A, then you're good to go. So under Medicare Part A, hospice covers specifically medications related to the terminal illness, DME, which is hospital beds, oxygen, wheelchairs, visits from nurses, aides, social workers, and then also extra support from a bereavement standpoint after your loved one passes or during that time as your loved one is declining. All these services are covered 100%. There's no out-of-pocket cost. Now, the frequency and the amount of which these services are given to you is all the discretion of the agency that you contract with and also the state as well. What's not covered under hospice care is items or services that are used to help cure the illness, because hospice is meant for comfort and dignity, and you're not seeking aggressive or curative treatment. And so now the goals have changed under hospice. So hospice does not cover anything under that. So when you're looking at specific like dialysis or chemo or IV hydration and IV meds that are really help to progress and to cure the illness, then hospice isn't covered under Medicare. So what does it cost? What do all these things cost under home health and hospice? Under Medicare, there's little to no cost actually. If you have a Medicare Advantage, there may be a co-insurance or an out-of-pocket expense, but most of these services underneath home health and hospice, if you have Medicare, are 100% covered. So let's talk about someone who has heart failure and they have meds and oxygen and they need help and they're under hospice. Will there be a bill that comes from the hospice? No. Now, if you go outside of those services or you go to a hospital and you seek more treatment or you do things that are outside of what that hospice is covered, then you may get a bill. Or if you have medications that are not covered by the hospice, then you may get a bill. But if you fall in line with those areas that hospice or home health covers, it's covered, which is great news. So I hope this helped you get a good understanding of what you have to pay or not pay underneath home health and hospice. If you like this video, please like and subscribe. We'll be actually live weekly every Tuesday with myself, and we'll be walking through questions and also guiding you to help understand what it means to care for your loved one at home, whether it's under hospice, home health, palliative care, veteran care, personal care. We're here to answer questions for you. And so, hope you like this video. Peace. We'll see you next time.